the Australian government sat on the fence for a long time when it came to supporting the TRIPS waiver proposal. Dan Tehan, the Minister for Trade, didn't wake up one day and decide that he was going to be a nice guy to support this proposal so low-income countries could get access to vaccines. It took people power. Amnesty International and other organisations gave more than 50,000 signatures to a petition to the minister, demanding that he does more to ensure that low-income countries get access to the COVID vaccine. And it also I think, dawned on Australia that they can no longer just be the kind of bodyguard of big pharma, ensuring that big pharma is increasing their profits at the expense of low-income countries. But it is about ensuring that we can do everything we can to enable countries to have access to the vaccine.
So you mentioned the TRIPS waiver there, and that essentially temporarily waives intellectual property rights when it comes to these medicines. But it's not just the pharmaceutical industry that's opposed to this, it's also big countries like Germany. So how do you change their minds?
So it's all about making sure countries like Germany know that it is in the interest of the world that we are a COVID-free community, that we get the vaccine to as many people as possible. And that's what we've had to do here in Australia. In Australia, we know that countries on our region, on our doorstep, if they are struggling with COVID, for example, Vietnam has less than 14% people vaccinated. Our nearest neighbour, Papua New Guinea, has less than 1% of people vaccinated. If these countries are struggling with COVID, especially when we open up in just a few weeks' time, that's obviously a risk to Australia. These are the same messages that need to be spread out to the countries blocking TRIPS. Like I said, countries like Germany, at the moment, all they're doing is being a bodyguard for big pharma. They need to put the interests of Pfizer, of AstraZeneca aside, and think about global health and people's access to health.
Do those big pharmaceutical companies, though, not have a right to keep the intellectual property given the millions of dollars they've invested in these technologies? I mean, what's the incentive for them to continue to innovate?
Yeah, look, I'm not here to talk about rights of big business. We're talking about the access of people to vaccines, of people's access to the human right to life, the access to the human right to health. We are in an unprecedented pandemic, a global crisis. If at any point big pharma and big rich countries were going to put self-interest aside and want to give access to health to the rest of the world, now is the time to do it.
Is this also an indication that the UN's vaccine program for underdeveloped countries, COVAX, that's been a failure, that it hasn't delivered on the vaccine doses that it was meant to for poorer nations?
Well, I think with COVAX, Karina, the problem isn't COVAX itself. It's the fact that rich countries like Australia, rich countries like Germany haven't really lived up to the promises that they made when setting up COVAX. COVAX should have been kind of the central distributor for vaccinations across the world. But instead what we saw was countries like Australia negotiate directly with big pharma around their vaccinations, cutting COVAX out. So then low-income countries that can't afford to deal with the big pharma directly, they just couldn't compete anymore. So it's not about COVAX failing to supply or COVAX failing to distribute. It's about big countries like Australia ignoring the rules and not doing what they promised to do when we set up COVAX in the first place.